My name is Prishtina, and I am a senior college student at New York University studying biology and linguistics. I aspire to be a surgeon, and I'm grateful for the opportunity to present our study on the correlation between a bladder diary and the validated lower urinary tract symptom questionnaire with respect to overactive bladder symptoms in women. Here are our conflicts. I personally have none. The goal of our study is to determine the correlation between an electronic bladder diary and the lower urinary tract symptom questionnaire with respect to urgency voids, the synchronon for the diagnosis of overactive bladder. We queried a database and identified women who completed a 24-hour bladder diary and a validated lower urinary tract symptom questionnaire. Men and missing or incomplete data entries were excluded from the study. We identified 262 patients who completed the lower urinary tract symptom questionnaire, and after exclusions, there were 140 women with a mean age of 54. There was a very weak positive correlation between the overactive bladder subscore and the number of reported urgency voids in the bladder diary. As indicated in the graph, the blue circle represents 1 to 4 patients, and the red circle represents 5 to 9 patients. Here is an example of the disparity between the two tools. This patient reported 12 urgency voids in her diary, but had an overactive bladder subscore of 3, well within the normal limits. In a patient like this, we use the conflicting data as a point of discussion with the patient to determine the true nature of the symptoms. These data suggest that perceptions of symptom severity may not align with the results of bladder diaries. This could be due to a disconnect between a patient's perception of their condition and objective reality, temporal variations in symptoms that may be better captured by a patient's subjective recollections compared to a time-limited bladder diary, and last but not least, a 24-hour bladder diary may not be long enough to capture the symptoms. It is well documented, the longer the diary, the more accurate the findings. However, longer diaries are associated with decreased patient compliance. In conclusion, a very weak positive correlation exists between urgency voids on a one-day bladder diary and the overactive bladder subscore in a validated questionnaire. We believe that the diary serves as a brief snapshot of the patient's experiences in a single day, and a questionnaire serves like a video because it takes into account an extended period of time. Each is a check against the other. Based on this data, we believe that it is essential to do both a questionnaire and a diary. In practice, when the data is consistent, we use the data as a substrate for treatment. When the two instruments offer opposing information, the data serves as a point of discussion with the patient to determine the precise nature of the symptoms. Thank you for listening. I look forward to responding to any queries you may have.